Hi, and welcome to Upgraded Biology. My name is Dr. Tammy Moralia, and I'm your host. Upgraded Biology is the outcome of 20 years of practicing functional medicine and specializing in hormones. This podcast is where we will present all the information and tools I've learned and continue to learn on how to harmonize and optimize all aspects of your health. Well, welcome to Upgraded Biology. So excited to have Dr. Joel Kahn here, board certified cardiologist, but a cardiologist that approaches things from an integrative and functional medicine perspective first and foremost. I'm so excited for you to learn about what tests you should be getting that your doctor may or may not be ordering, what lifestyle and nutrition hacks have been shown to work the best, and when should you be on medication? Let's dive in. Welcome, Dr. Kahn.
Thank you so much. I'm excited. You have a great audience, and there's so much confusion. And I hate the word misinformation, but there's a lot of it.
Yeah, there's so much out there. It's hard to know what's right and then what's right for you and then what's right for you right now, because a lot of menopausal women, their cholesterol and their cardiac risk changes even though they're still working out, they're still eating well, they're still within a few pounds of their great weight. So let's dive in. What would you say to somebody who is just sitting down with you for the very first time? How do you start a cardiac workup from a functional, holistic perspective?
Well, I just shut off Zoom from exactly that scenario, maybe 2 minutes before we joined into this podcast. So it's something I do all the time, either live in the office, Michigan and Florida, or telemedicine in about 22, 23 states. A lot of women come to me. They've read, they've listened, family history, they have a friend with heart disease, but they're totally fine. They've never been to the emergency room. They've never had a stress test. They've usually never had anything more than their primary care doc. So I spend up to an hour asking all kinds of questions, and some seem silly. How often you going to the dentist, and do they probe in your gums, and they tell you those terrible numbers like 5, 6, 7, 8, the pocket depth, and you have silver fillings, and do you like to spray Roundup on your roses, and all kinds of questions. Of course, breakfast, lunch, dinner. Very detailed about family history, who had the bypass, the stent, the stroke, the heart attack, the fibrillation, the aneurysm, whatever. So we spend time asking questions. If it's a live exam, of course, I'll do an examination. If it's not, I'm going to insist that they get a home blood pressure cuff. People have Apple Watches and Whoop bands and Fitbits, and they don't have a home blood pressure cuff. Nope. Spend your money on an Omron Platinum home blood pressure cuff before you buy an Oura Ring. It's much more important. They're both nice, but the blood pressure cuff is indispensable. Start monitoring your blood pressure. Don't put it in a cabinet. Leave it on the end table and call it, nouveau art. If they can put a banana with a piece of masking tape for $6 million, you can leave a blood pressure cuff on your end table. And after the standard history and physical, if it's a first visit, I personally order most labs through Quest. I order most labs through insurance. But a lot of people now are getting Function Health, $500 self-pay panels, or lifeforce.com, which is fine with me, or they go to lifeextension.com. But I want a really deep panel, and you absolutely have to get lipoprotein little a, which is something that many people right now are scratching their head. What did he say? Lipoprotein little a, because it's a lowercase a. If you write it with a capital A, it's a different cholesterol compound, so it has to be a lower a. Every lab runs it. It's a genetic cholesterol affecting 1 out of every 4 women. It also affects 1 out of every 4 men. It doesn't matter how much you exercise or what you eat. It could be sky high since you've been 1 month old, and it might be affecting your arteries adversely. It may also affect one of your heart valves called the aortic valve. And less than 1% of doctors in America right now are checking it routinely, even though it's recommended recently to be checked routinely. I've been checking it for about 15 years. It's a huge portion of my practice because lipoprotein A can be very damaging. And until you have your blood work, you don't know. There's nothing I can hear with the stethoscope. But it doesn't respond very well to lifestyle or statins like Lipitor and Crestor. So I treat many, many people for inherited lipoprotein A, but step one is get it checked. Know your inflammation, at least your high sensitivity C reactive protein. Know your omega-3 level, know your vitamin D level. I like a lot of insulin resistance testing, at least fasting blood sugar, hemoglobin A1C, fasting insulin. You can do a fancy one. I added recently fructosamine, kind of a fun one, not expensive, available everywhere. It gives you like a 1 month average on your blood sugar. And you can do more than that. Oh, I of course want a cholesterol panel. I like the more advanced, very inexpensive. I
The
usually write,
NMR?
yeah, the right. I write, cholesterol panel with NMR lipo profile, NMR, Nancy Mary Radish, and that's been available for 20 years. And yeah, you can have two people with an LDL of 100, but when you get the NMR profile, you get a very different results. A whole lot of ugly particles on one and a whole lot of pretty particles on the other. Usually
So let's
reflecting.
let's
What's that?
dive in. I'm going to
Yeah.
stop you because you're just downloading all this beautiful, amazing information. I'm going to go back to your mouth and your teeth. But at this time, I want to dive into a little bit deeper explanation for our listeners about this beautiful test called NMR. So you elucidated that there's different types of particles. You
Right.
have quote unquote lousy LDL that's elevated, but then it breaks it down into different types. What type of particles are we seeing on the NMR?
Yeah.
And then what do they mean?
Well, first of all, cardiologists, I think appropriately, spend most of their time, if they're talking about a cholesterol result with a patient, looking at LDL cholesterol under 100, under 70. Now we're pushing it under 55 in people with serious heart disease, not in the average person. But if you look at your lab slip, you might never have noticed it. It'll say LDL calc, CALC. It's a calculated number called the Friedenwald equation. It's been around for 50, 60 years. It's not even directly measured. So LDL is super important for your risk of developing clogged arteries. But you're using a 1970s test that's really a guesstimate. That's not cutting it in 2025. So the NMR directly measures your LDL, but it does it in a way called LDL particles. How many little pieces of LDL are floating in a volume of blood at any given moment when your bloods are on? But it'll break down, are those LDLs something called small, dense LDLs? I call them like golf balls. If they hit the window, they're going to break it. If they knock into your artery wall, they may cause plaque, versus large LDLs, fluffy LDLs, like a wiffle ball, not going to break the window. Less prone. They still damage arteries, but less prone. You'll get a lot of information about HDL, but we do not know much about HDL right now. So I don't want to talk about HDL. We'll waste our time. And you'll learn a little bit more about your triglycerides. And again, you actually don't need to be fasting to do an NMR lipoprofile. I prefer people are. You do need to be fasting to get a fasting glucose and a fasting insulin. So I'd say about half my patients come in fasting, but I don't mind drawing their labs right now if they're in my office and they're not fasting. We can deal with that down the road. And there's studies that the LDL particle number predicts your risk of stroke and heart attack better than the standard LDL. The other one I didn't get to, but I was going to, and I don't want to confuse people, but there's a very simple, inexpensive test in the cholesterol world called apolipoprotein B, APO lipo, LIPO protein, capital B. Now it's a capital B. We
My
call it
favorite.
yeah, we call it ApoB, APO capital B. It's about a $20 blood test. It's one number. It's been in the science literature and available for 30 years plus. Inexpensive. That all the bad particles, these LDL particles, the lipoprotein little a particles, show up in this one number. Under 90 is the usual cutoff. If you're a sick heart patient, we like it way under 60. But if it comes back and it's high, I'm very suspicious that you inherited lipoprotein A, and I'm going to check for it anyways. So, yeah, get an NMR lipoprofile. I didn't mention homocysteine. Everybody should have a homocysteine blood test without a doubt. And then your kidney, your liver, your sodium, your potassium, but everybody's going to do that for you. So nothing unique to say there. There is a new one. I like fancy stuff. It's available everywhere. Cystatin C, CYSTATIN, capital C. Nothing to do with statins, even though it sounds like it's cystatin C. It's really a kidney function test, but increasingly we've got data that it provides a prognosis. You're likely to develop heart attack, strokes, bypass, or not. So I like to see it. Some people argue the standard kidney labs are missing some people with kidney disease, so the cystatin C can pick that up.
These are also great. And then when I order the NMR for my patients, it often has that IR index. Could you
Yeah,
dive a little bit into
yeah,
the value of the insulin resistance, the IR that
right.
comes with that test? Because it seems like, you and I went to traditional Western medical school, but then we both practice more in a holistic way as much as possible. And insulin resistance wasn't really what I learned in school
Well,
as being a cornerstone of heart disease. So, can you tell us a little bit more about insulin resistance, this particular
yeah,
test, and then what do we do about insulin
yeah. Well,
resistance?
I'm so old. I'm 42 years out of med school graduation, actually. And, America was pretty thin 42 years ago, and there wasn't much need to talk about insulin resistance. It's not exclusively related to body weight, but it's sure largely related to body weight and obesity. But, anyways, we would like to know when your pancreas secretes insulin, or even if you inject insulin as a type 1 diabetic, if it's efficiently causing your blood pressure to go down. So if it is, you're insulin sensitive, and if it's not, you're insulin resistant. So there's a whole variety of blood tests you can do, like a fasting insulin, a fasting glucose, a HOMA IR, an insulin resistance score. But if you do the NMR lipoprofile, and if you're fasting, they can analyze the pattern of those particles. And there's a pattern that suggests insulin sensitivity, and there's a pattern that suggests insulin resistance. I think they put it on a score of 0 to 100, and they'll tell you where you fall into that. So it's a valuable number for sure.
I
But I
love
even
that.
like check your waistline. I mean, if you got a waistline of 35 for a woman or 40 for a man, you're probably insulin resistance. Or some people use this is recently I've learned this. I'm I'm 5'9", so what is that? 69 inches. Cut that in half, and your waist should be less than that. So your waist should be 34 or less. If your waist is more than that half, you're probably insulin resistance. That's a simple
Okay, let's say that again. That's a really powerful
Let's
way
just say
for
there's
people.
somebody, let's take a simple one. Oh, a woman listening is 5 feet tall, not that unusual. 60 inches, the waist should be under 30 inches. If the waist is over 30, she's likely insulin resistant with visceral fat around the organs. Simple
So
one.
your weight in inches, your waist should be half or less.
Right.
That is
Okay.
such a powerful tool as people can be the CEO of their own health. Now, you said, a woman, visceral fat. That just makes my brain think of when estrogen goes down and visceral fat starts to accumulate in a woman, and all this stuff happens with her cardiac health. I actually hope and wish that my menopausal women have hot flashes
Right.
so that they'll come in. I hope they're miserable with their hot flashes because I want them to get checked. I want to know what's going on with their hormones and help their cardiac risk.
Right.
Dive a little bit into the perimenopausal, menopausal woman and how hormones, or the decline of our hormones, affect our cardiac risk.
Yeah, I would agree with you because I'm a big proponent of being evaluated and, if appropriate, placed on HRT therapy close to menopause, and then be like my 92-year-old mother, still taking hormone replacement therapy, and she's fixing computers. I mean, her brain is so sharp, and I think a lot of that is good hormone optimization most of her life. But I have to cycle back to the woman I'm talking to for the first time. After the labs, the next thing I'm doing, I'm gonna just look, is I'm gonna pull out my prescription pad and I'm going to write her a prescription for some kind of blood vessel test, but almost always the coronary artery calcium CT scan, which is not covered by insurance in most states. It is in Texas. About $100 CT scan. You're lying on a stretcher. They put you in a CT scanner, which is not claustrophobic. No needle, no injection, no iodine, no allergies, no pain, no claustrophobia. 10 seconds, you hold your breath and you go home. And the next day, a report comes out and says your coronary artery calcium score is 0. That's the woman that has a little happy party. And if anybody puts her on a statin, it's almost outrageous because you have clean arteries and you work on lifestyle and you consider supplements. Let's say your cholesterol is not optimal or your blood sugar is not optimal. And 40 to 50% of women are going to come back not 0 around
But this
menopause.
woman who's 0
Yeah,
and she has high LDL, high ApoB,
right.
high LP little a, and a coronary calcium score of 0, no medication. Just dive into lifestyle, nutrition, weight loss, insulin resistance, and supplements. Yes?
Absolutely. Join a gym, eat an apple, up your fiber, consider plant-based eating, which is my platform for my own life for many, many decades. But it's not the only way to eat, but it's a good way to lower your cholesterol and stay healthy. And repeat the calcium score in about 5 years. Just like if you had a clean colonoscopy, it's not for life, it's for a while. The calcium score, if 0, 5 or 6 years. We have more advanced CT scans, but they're not $100 and they're not simple and they're more radiation and it's not prime time. We can't even get 5% of women at menopause to get a prescription from their primary care doc for that test. I order it on everybody. Most cardiologists don't, but it has been called the mammogram of the heart. If you're going for mammograms or thermograms or colonoscopy or Cologuard, go for a heart screen. Find out, test, not guess, is what I use on social media. Because there is data. What if you're not a 0? What if that test comes back 102, 98, 284? I mean, this is what my practice is full of. Women in their 50s and 60s who already have heart disease, in no question. And then we got to figure out why. Then I'm doing even more labs. What's your ApoE status and some other genetics and deep inflammation labs and toxicity labs, heavy metals, and the whole 9 yards, and looking at psychosocial and diet patterns. And we really got to work hard so that woman doesn't have a stent by the time she's 65 or 70.
I don't think most women realize that once you get into perimenopause and menopause, cardiovascular disease is your number one risk.
Yeah,
It's
it's
not cancer.
yeah,
It's your heart.
we just had a paper published by the American Heart Association that once again in 2025, heart disease will be the number one cause of death in men and women. We've made, not a lot of inroads on that statistic. Cancer is number 2 and certainly important. But, cancer people get frightened of, that. They get their mammogram, their colonoscopy, maybe they do their Gallery blood biopsy cancer screening test. Maybe they go for a total body MRI if they have the funds to do it. Those are all controversial, but people read about them. I mean, you just don't see, the sexy people of Hollywood talking about coronary calcium scoring. It's missing the boat.
Now, the coronary calcium score, to my understanding, is checking the hard plaque. And are you
Right.
worried about the soft plaque if somebody has a coronary calcium score of 0?
Yeah. So that's a very obviously intelligent question. That inside an artery that's diseased, there can be 2 kinds of plaque: soft plaque like butter, hard plaque like bone. And the calcium score only picks up the hard plaque, which is a little bit older and a little more stable and a little lower risk. But when we're basically screening close to nobody for heart disease, which is the case in America right now, of all your listeners, I don't know how many have had a coronary calcium score, but not enough. What's really practical is $100 10-second test that's easy, practical, or is a coronary CT angiogram, which is the more advanced CT scan where they have to inject iodine dye. Some people are allergic, and it doesn't take too much longer, but you have to have a very low heart rate. So you have to take a prescription drug an hour before, and it can cost $800 to $1,500, not $100. Is it really, really practical to start talking about doing that routinely, or the calcium score? So once we get to 100% penetration on the calcium score, then we can talk about adding the fancy tests. So I start simple, and if it comes back, oh my God, you got a calcium score 250, you're a nice 54-year-old woman, and that's 98th percentile for women your age, way out of line. I will move on to the more advanced to see the soft and the hard and how much narrowing or stenosis there is. And it's a
So,
very wonderful test. It's an amazing test to do the more advanced one, but that's not the conversation I'm going to have on that first visit. But once in a while, a woman comes into my office and knows all this and says, I want, the top flight Ferrari test, or the Birkin bag test, whatever analogy you want to make. And we'll do that if they demand it, but it's not my approach as a first pass.
yeah, that's fantastic information. So here we are. Does your recommendation change if it's a man with elevated ApoA, LP little a, and LDL with a 0% calcium score? Just
Um,
retest in 5 years? Is it the same for a man and a woman?
I'm a man. I had a calcium score 0 as recently as 5 months ago at age 65 and a half. But I have done a coronary CT angiogram with iodine dye and artificial intelligence interpretation. But I kind of did it as a biohacker, a term and I know. And right when it came to Detroit to test it out, and I had a pinhead of soft plaque, literally as much as would fit right there. And I might do it again at the 5 year mark, but there's more radiation, so I'm going to hold off. So being a man alone wouldn't really influence me very much. Now, there's an incredibly small risk. I've had now 2 people. One had completely normal labs and a calcium score 0, who presented to an emergency room 7 months later and got a stent because of soft plaque. This is about 20 years ago. I don't know why, because I did crazy extensive labs that showed nothing. But I've recently had a guy that a couple of years ago was a 0, but he was a metabolic disaster. I mean, elevated hemoglobin A1C. He's Indian, so he's got the whole insulin resistance, little pot belly, and the whole thing. And he recently got a couple stents, and I'm following up with him, in fact, next week. So it can happen, but that's out of thousands and thousands of patients. So I still think it's not reasonable to recommend. I know there is, a national super advanced, super expensive chain called Fountain Life, and they skip the calcium score and they go right to the high-end CT angiogram. But if you're willing to pay a $50,000 a year enrollment fee, you deserve the fancy test. But I'm not sure it's actually right or necessary.
Wow. So no statin for the man who has elevated LDL and a 0% calcium score.
Well, just to compound the conversation, if I do have somebody whose labs concern me, but the calcium score is 0, it's usually not going to do that $1,500 CT angiogram. What I often will try and arrange, it's hard to find, you can do a carotid ultrasound, these 2 beautiful arteries that are brain, very important arteries, nice, big, straight, superficial arteries, 20 minutes of a little ultrasound, painless, no radiation. And if you can find a place that does it, called a CIMT, carotid intimal medial thickness ultrasound, that's special software. Very often I'll see plaque, calcium score 0, but I see some plaque in the carotid arteries. Might be a little, might be a lot. And at that point, it's going to up the game to better diet, better lifestyle, maybe supplements, bergamot, berberine, Reggie's rice, niacin. Probably not going to rush to a statin, but I'm not going to just pat that person on the back and say, you're fine. I'm going to say, you've got soft plaque. You're starting to develop it. It's not easy to get a CIMT. We do it in my clinic, and there's places, but even the major universities and major vascular departments, they do a standard carotid ultrasound, but that just doesn't cut it. But there's a couple national companies that travel America, and I have some patients in Seattle. I can usually arrange it, or San Francisco or LA. Not always, usually.
So here we've talked about the testing, getting extensive blood work, making sure that you're getting your ApoB and your LP little a and your NMR and your insulin resistance and your coronary calcium score. If you don't look, how do you know what is or isn't there? So now what? Now we've got high insulin resistance, we've got elevated cholesterol, and we've got a bad coronary calcium score.
Yeah.
What do you do first if it's a woman
Yeah.
who's in early menopause? And what do you do first if it's a man?
Yeah. So I'm a lifestyle guy, lifestyle cardiologist. I'll write prescriptions, every prescription on the planet except narcotics and benzodiazepines. I don't write for those ever. I write for ivermectin, a very good drug, but I don't write for Ambien. But I'm a lifestyle guy, so I give my patients a curriculum. It depends what they told me they're doing, but I mean, I want them to watch Forks Over Knives and What the Health. Maybe read one of my books. Maybe read Dr. Ornish's book, Undo It. Maybe read Dr. Furman's book, The End of Heart Disease. Maybe read a Pritikin book. Join a gym, get a trainer. Maybe I'll get them a coach through an online, coaching program. And there's a lot of these to give them a weekly call and see if they're up to date. And I may just do that and repeat the labs in 3 months. And I have a recent, it's unusual, but a 46-year-old man that was just out of control. Booze, cigars, steaks, fries, weight problem, metabolic disaster. And I'm telling you, he got God. And I helped him find God sort of, but a couple appointments, I showed him how bad. He actually had calcium score 0 and clean carotids. So he hadn't damaged himself. He's very lucky. And at any rate, his last cholesterol went from 260 to 130. Not a pill in his life, just all lifestyle. And he didn't even go fully plant-based. He added a lot of fiber-rich foods for sure. But he just started eating real food, got away from processed crap, cut the booze out. And, some people will do that. So he doesn't need a statin. I was worried about him, but he doesn't need anything. But most people aren't going to, embrace lifestyle to that degree. I wish they all did. There's many that do. And, I'll bring them back and I may have to nudge them with some bergamot, berberine, niacin, metformin if, they're insulin resistant. I'm pretty low threshold for metformin, even though it is a prescription. And anything they might need for their lipids, although, we have actual strong university data with a calcium score 0. The American Heart Association says you don't need a statin. And I agree too. The number needed to treat to help one person avoid a heart attack is so phenomenally high. You don't need it. We have data. If your calcium score is 0, you don't need a daily aspirin. But if your calcium score is over 100, you probably need a daily aspirin and possibly a statin if you can't correct it. So I'll give people time to, improve their lifestyle. And some do it dramatically and some do it minimally. And there's no difference between men and women. I'll have that conversation with women about HRT. I have that book, Estrogen Matters, on my desk. It's lying out all the time. I encourage them to read it, to break through some of the myths about HRT being dangerous in most women. I'll refer them to some publications by my cardiology friend James O'Keefe, who often writes articles with a gynecologist, Felice Gersh, an integrative gynecologist, in medical journals about the safety of HRT in most women, kind of the new look, the new approach. So we'll do all that.
Well, and it's not just safe. It seems like HRT started within the first 10 years of menopause actually can help protect against cardiovascular
Right.
disease. It seems like the anti-inflammatory properties of estrogen are helping those vascular parts of our heart stay healthy. So I always say, you know, the race is on for prevention. One of my favorite lifestyle cardiovascular sort of optimization tools is sauna.
Yeah.
What do you think about sauna?
Well, I own one. My kids own one. I recommend it to my patients. I think it's a wonderful therapy. It's actually science based. Japanese researchers in the last 30, 40 years found that people with serious heart disease, particularly congestive heart failure, spending a short time in a hot infrared sauna and then relaxing a bit, wrapped up to cool down, experienced measurable benefits, like they could walk further and their arteries were healthier. It can lower blood pressure. It can help with body weight, help with inflammation. So if somebody can get to a healing center that offers an infrared sauna, I like full spectrum infrared sauna. I like them now. Some of them have red light panels right in the sauna. And if you can afford one for your home, but you got to be a little picky. Some of them have a little higher EMF exposure, and I use a brand in my home that's been rated, third party tested for very low, EMF exposure.
And I love all the Finnish research about traditional
Yeah,
sauna and
right.
just,
Yeah.
those infrareds have great benefits, but you can't really get to that 170-degree magic number. Or maybe get a combo unit. And I've had some patients recently who've been able to use their HSA account to purchase a
Wow.
sauna. Yeah.
Yeah, I've
Just
written
need a little
notes for people.
letter from your doctor that says that, you're at risk for cardiovascular disease. Hello, who of us over 50 isn't? And then they can use their HSA account to purchase it. You can put it in your garage. You can put it in your yard. You could, you don't need to be fancy, but I honestly think it's one of the biggest things. I think it's better than any medication we could ever get patients to take.
Yeah, and then the other compounding part is with us all, unfortunately, being exposed to microplastics and phthalates and BPA and DDT. So, regular use of a sauna may be one of the most effective ways to battle this crazy life we have, this toxic life. So, another important need. Where was the latest paper? Microplastics throughout the brain and some autopsy studies. What a wonderful thought. Your whole brain is full of the wrap that your sandwich came in, at the cafeteria or something.
Yeah, I just saw a documentary called, I think it's called Buy More. And it just made me so frustrated. And then I went to the grocery store and I was like, why is my vegetables covered in plastic? I don't need corn to be covered in plastic. I don't need anything to be covered in plastic. It's so frustrating. Well, we're getting to the end, and I want to make sure that I have you share the information about your teeth for cardiovascular health and then omega-3 fatty acids and inflammation.
Sure. I mean, the teeth thing has been around a few decades, that people with periodontal disease, people with tooth loss, people with tooth loss have a higher risk of actually dying. So, I've had issues at times. I got to go to a periodontal specialist, and I've once in a while thought, just rip them all out. I'll wear dentures. Well, that's a stupid thought of mine, because, people that are edentulous actually have a rather worrisome outcome. Although, of course, most of them, it's not an elective procedure. It's just they've had really bad dental care. So, getting good dental exams, little hidden pockets under root canals, under molars, under implants can cause chronic inflammation. Have somebody probe your gums and read those numbers out. It's been periodontal disease has been linked to coronary disease, erectile dysfunction, dementia, three-dimensional cone beam CT scan that some dentists have access to. Or you can also have them swab your mouth and send it for a bacterial analysis, and might come back with some really nasty bugs like porphyromonas. So, yeah, a good dental exam is really, really, really important and ongoing. And see a periodontist if you need to. And then your other comment, omega-3, we go back and forth. There is some data that very high dose omega-3, 4 grams a day, 4,000 milligrams a day as a supplement, not as food. But, that'd be eating a whole lot of
I'd be
salmon, I
a
guess.
lot of salmon.
Yeah, a lot of salmon is up. But anyways, taking a very high dose, but that's common in cardiology clinics. We have several prescription omega-3s that are 4 grams a day. May up the risk of a heart rhythm you don't want called atrial fibrillation. I don't use 4 grams. I use about a gram, occasionally 2 grams a day. But if you do the blood test, God, a lot of people are omega-3 deficient. They don't eat salmon, they don't eat flaxseed, they've never heard of hemp hearts, they don't eat many walnuts or leafy greens. And it's not ideal to be omega-3 deficient. They're just, again, in the last week was a randomized study published. It made headlines that adequate omega-3 and 1,000 milligrams a day slowed biologic clocks like the grim age or the true age. We hear about these self-tests you can order that Brian Johnson has made incredibly famous and all. There are algae-based omega-3s, so a lot of people are either plant-based or allergic to fish or prefer not to use fish. So many options now we didn't have in the past.
It's so true. And instead of getting fearful about, oh my gosh, am I taking too much? There is a test. I love Omega Quant because it's an average of the omega-3 fatty acids. And,
Right.
but even just testing an omega check, which is that moment in time when you're eating your usual diet, then that's your usual amount. Back to the test, don't guess, and personalized medicine, right? I mean, we have this
It really
overarching.
is. You know, there is not one stop shopping for everybody. I mean, and that's what we've done. You're a 48-year-old woman, your cholesterol comes back 230, and 95% of docs hand out a prescription for a statin. And you have no idea if that person's really at risk or not at risk at that point in their life. They're probably not, but you don't know. And we were talking just before we went on about, the research studies. Now, I'm all for research studies, but we just took primary prevention with statins. People didn't have a calcium score. We were treating gazillion people who didn't have disease. And a very bright cardiologist said, we don't treat people without cancer with chemotherapy. Why are we treating the public with statins when they don't have heart disease? And I mean, you could argue, yeah, but we're preventing it 10 years from now. But you can monitor this disease with the carotid, with the calcium score, with adequate blood work, and jump in with a statin if you absolutely need to at some point when disease is present.
So many great ways for us to be the CEO of our health and take care of our heart. Thank you so much for this great. Oh, this episode is full, juicy, 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 full of ways people can.
Thank you. And it's so important that we have this conversation regularly.
Yeah, and they need to be the CEO. They need to ask their doctors for these important tests and implement the lifestyle. Thank you so much for sharing your brilliance. I just love connecting with you.
Thank you, Dr. Tammy.
Bye. Thanks.
Bye bye.